Okay.
Hi.
Yep, let's go.
Hi, my name is Wendy Ross. I am the director of Jefferson Center for Autism and Neurodiversity. I'm really excited to be here today with Sabra Townsend, our director of operations, and Dr. Jane Tobias, our nurse practitioner. We are here to talk with you today about creating an ouchless vaccine experience for all. So our objectives today are to talk about the aspects of autism and neurodiversity that present challenges in getting vaccines to those with things like intellectual disability and who think differently. We're also going to talk about strategies to improve the overall vaccine experience. Lastly, we're going to reflect on your role in helping people feel that they belong and are really a priority when they get their vaccine. So first, some background. 1 in 54 children are diagnosed with autism. Over the next decade, over 1 million youth on the autism spectrum will be entering adulthood. Individuals with autism have rates that are much higher of inpatient hospital death. They are in fact 1.5 times higher than individuals without autism. Furthermore, those with autism face significantly higher barriers to any healthcare service. Autistic individuals report lower satisfaction with healthcare overall, and in fact have lower rates of regular primary care. A common complaint is ineffective or insufficient communication with providers and even front desk staff. This has a lot of negative impacts, including worse health outcomes, increased stress, and higher use of the emergency department. When we talk about neurodiversity, we're talking about those that are on the autism spectrum, but we're also including those with processing, problem solving, and communication differences. This includes those with intellectual and developmental disorders, psychiatric diagnoses, neurological problems, things like PTSD, and aging. In fact, anyone with a novel or stressful medical condition or significant life stressor sort of fits under this neurodiversity category. This can include family members of those with intellectual disability or developmental disorders like autism. There's a lot of benefits of embracing diversity. And if you consider diversity is much more than when we think about racial diversity, it of course includes that, but also includes neurodiversity. Being welcoming benefits everyone. When we embrace others who have different ideas and different perspectives, we all benefit. Also, feeling good about our work, having an intrinsic motivation, really matters to our performance. In other words, we work much harder when we're working for more than just our paychecks. The difference between inclusion and belonging is that when we belong, everyone kind of has a place. Whereas when we speak about inclusion, it's a little bit more like, I'm here and I might let you in. You see the difference? If you think that diversity doesn't include disability, we need to rethink.
So when we talk about neurodiversity, autism, intellectual disability, as we move forward through the presentation, we're going to focus on 2 of these 3 areas, communication and behavior. Of course, socialization fits into all of it, and that is the ability to connect. But again, when we're providing care in a vaccine center, some of the biggest obstacles and barriers, as Dr. Ross had mentioned, is that communication, ineffective or insufficient communication. So to provide you just with a brief background on autism and letting you know what your community looks out there in terms of numbers of individuals that may have autism or be on the spectrum or include a neurodiversity. Approximately 1 in 54 people have autism, and we see it more often in boys than in girls. Autism knows no boundaries. It crosses all racial, ethnic, and socioeconomic borders. Approximately 70 million people worldwide have autism, and in the United States, 50,000 people will be entering adulthood every year with autism. So, as Dr. Ross had mentioned, we think about our aging community as part of a neurodiverse community. Keep that in mind as well when you're providing vaccines. The population of individuals that has autism is increasing and getting older. And this is an interesting piece of information which you may start to see in your clinics, that many young adults, when they leave the pediatric office that have autism, that have an intellectual disability or a neurodiversity, really face challenges in getting health care in the adult world. So therefore, they're going to go without care. They're going to go without routine vaccines, all those things really that they're entitled to and should have. So the role you're playing right now in being there to provide these vaccines is critical and it's life-saving. A lot of people with autism are unemployed, and we're really hoping to change that. We hope possibly that they could even find a job in the vaccine center. They have tremendous strengths that we need to think about and build on and leverage and use when we're working with them. And as Dr. Ross had mentioned, parents are under an awful lot of stress, and parents can also be affected by neurodiversity because of this stress. We treat the whole person, we treat the whole family when we see them in our vaccine clinics that we run. We provide the same type of care across the board because we all want this type of care. So a real important aspect that needs some attention and is really easy to think about and develop strategies around is communication and just providing information and getting information from those that you're working with. People with autism or neurodiversity may not respond to their name. So when you're calling somebody to come back, and if you're calling them by their name, you may want to first give them time to recognize they heard their name, get up out of their seat and come back. In other words, patience really is a virtue. They may have difficulty understanding a lot of directions that you're giving or how you're giving them. In my experience, I find the easiest way is to break it down, your directions, into short, simple phrases, say them slowly, and then again, give that person time to respond or to ask a question. Remember that when you're working with somebody with autism or neurodiversity, this is not an in and out experience. In 5 minutes, you're going to give them the vaccine and then they're out to the observation area. So, really, just set aside time and be patient with them. They may have trouble expressing their questions, expressing their needs, or how they're feeling. And they may not speak, meaning they may not speak verbally, but they will have an awful lot to say using an alternative means of communication, such as pictures, a letter board, or sign language. In your toolkit, you have an iPad. That can be really helpful as well. But what I always do is ask them or the person that they're with, what is the best way to communicate with them? Is there something that you have that we can use? They may seem totally typical from the outside looking at them, but it's when you start to have conversation or that socializing piece of it that you may notice they have difficulty giving you direct eye contact, or they're slower in a response to you or in asking a question. Again, they have language but may not be able to have a conversation. They may use singular phrases. They may repeat something back to you that you have said, such as, "How are you today?" And they may say that back to you. They may struggle to experience and convey symptoms. This is very important to remember, particularly if you're working in the observation section of your vaccine center. It's important to use your eyes and look at physical distress. Is that person starting to sweat or perspire a little around their brow line? Do they look like they're grimacing behind their mask? Does their parent or their caregiver seem concerned with how they may be acting in the chair next to them? So make sure that you're checking in a little more often with this family and with this person. Things can be taken very literal by these folks, and they may not understand sarcasm or humor. A lot of times we may use sarcasm or humor, particularly in an anxiety provoking situation, But again, it's important just to stick to very concrete words and not use slang words around people with autism, because again, they may not be able to interpret what you're saying. Behaviors is the second component of some of the different challenges that folks with autism or neurodiversity exhibit and present with. So I want you to think of walking into the convention center with 1,000 people getting vaccines and the loud noises and the bright lights and the echoing and the overall busyness. That's overwhelming for somebody that is neurotypical. It can be extremely overwhelming for somebody that is on the spectrum or has neurodiversity. So, what we want to do is change that for them. How can we decrease the amount of that sensory stimulation coming at them? And really recognize that that is overstimulating and can cause anxiety for a person. Because of this, they may get upset more easily. They may have atypical or repetitive behaviors when they become anxious or they become fearful because this is a new building, it is a new situation. Some of those behaviors may include spinning or rocking, pacing back and forth, looking out of the corner of their eyes at something, putting their hands over their head, or even banging the side of their head. These behaviors are a protective mechanism. This is how somebody tries to self-calm and to shut all that negative stimulation out. What can we do as vaccinators in our centers? We can look for a quiet spot. We can set up a station that is away from all of this busyness. Put some of the tall shades up around that block out the noise. Bring them into a calmer, quieter area. They may get stuck on certain topics and also be very rigid about expectations. And a common example, and I think this can apply to anybody, is if you're very punctual and you're on time for your 10 o'clock appointment and it's now 10:10 and you're still sitting there, you want to know what's going on. For some of us, like myself, that follow the clock to the T, I start getting a little anxious. Why are they running late? Nobody's talking to me. This is where communication is so important for you and your team members. Let the person out front who is registering everybody know we're busy back here. We are running behind. Please let people know as they come in, we're running 10 minutes behind, but we will be there and we will get to them and we will communicate any other changes to them. The same when you're done giving a vaccine and they move to the next station for observation. They need to be there for 15 minutes. What's really helpful is if you're able to provide them with a timer or an iPad where they can see the minutes tick down and they know exactly how much time they have left. The last aspect I do want to touch on is what we call elopement. And what that means is when somebody becomes really anxious or they're in an uncomfortable situation or a very overwhelming situation, the first thing they do is run. We know it is fight or flight. And we want to make sure, though, that safety is a priority. So consider where you're having your vaccine center and your vaccine station for individuals that may be on the spectrum or have a neurodiversity. Put it away from a door. So the natural thing for them is not to run to a door that leads to a street or a busy sidewalk. Put it at the end of the hallway. Possibly even if you can, provide a room where you're able to shut the door. So at least you have a little time if somebody gets up and starts going for a door to remain calm and to try and get them into a safe environment.
So we have a mnemonic for you to remember the different strategies, and we call it SPARK, so that you can think of the things that you'll need as you're putting your vaccine clinic together, as you're vaccinating, as you're observing folks who have been vaccinated. Some of the strategies that we've mentioned, you want to see with more than your eyes, you want to listen with more than your ears. You definitely want to take in the whole setting to make sure that what you're doing with the person who's being vaccinated will be the best setting and environment for them. Patience, as Jane said, is definitely a virtue. You want to take a beat. If you ask a question, give it a minute. If you need to hear the answer, you want to give a person a time to respond. Attending to what's going on, obviously the main objective is to make sure that the person is properly vaccinated. But you also want to make sure if the person is anxious, you may reach into your toolkit and get a fidget that may help them be a little less anxious. If they have someone with them, you want to be able to have them be comfortable. So attend to your full surroundings. Responding as opposed to reacting with what's going on. And to be able to respond means you need to be comfortable with the tools at your disposal. And always, always be kind. Kindness can make the difference in a situation. So if they came in anxious, you may not be able to change their anxiousness, but your kindness won't make the situation even more anxious. So that's a mnemonic that we have, SPARK, to remember the tools that you have at your disposal. So here's some things, if I were a person being vaccinated, if I were a person who was neurodiverse, things that you might know about me. As a center, we've done some focus groups and talked with people who are neurodiverse, who are on the spectrum and may have intellectual disabilities. And these are some of the things that they said. So I'm going to present it as if I was the person who has the neurodiversity. Yes, I do want to be vaccinated. I want to stay healthy, but I'm really worried about getting the shot. If I come with someone, I've come with my friend or my caregiver, or I maybe even come with my auntie or my uncle, please let them stay with me. That really shouldn't be a problem. They may be getting vaccinated too. I might want to have that person be vaccinated first so I can see how it goes, or I want to get vaccinated and get it over with, but I also want to make sure that they're safe and get their vaccine as well. I've never been in this location before. There's a lot of lights, there's noise, there's sounds, there's all these people, or maybe there isn't a lot of people. It's just a new environment for me. And so I'm really kind of worried and anxious about what's about to happen. And if it's bright, maybe I need to have sunglasses. Maybe I need to wear my sunglasses. If it's really noisy, there may be noise reduction headphones that I can put on so that sound can be dampened. And that won't have any effect on getting the vaccine from the vaccinator standpoint. It's just that I need to wear the sound canceling headphones. Now, we all have masks on. I can't see your mouth. I hear you, but I can't see that you're happy or anxious. So if you can use a positive tone of voice and speak clearly so I can hear you, then I'll probably feel a little better. Give me a chance to answer the questions that you have, and please be patient and speak to me respectfully. It's always good to tell someone that they're doing a good job. So let me know if I did great, let me know, hey, it's over with, you did great. And now we're going over to the observation session. Take a deep breath. These are kind of the things that help me stay calm. Ask me. Maybe there's a favorite song that's out right now, or maybe I have a particular character that I like. And again, it's always good to let someone know that they did well and that they were strong and brave in getting their vaccine shot. Pardon me. So in the observation session, it's always good to let someone know that they have 5 minutes left, that they'll get their vaccine card when they're finished their shot. So you have to watch very closely, as we've mentioned previously. I may not exhibit symptoms the way a person who may be neurotypical would. So use your eyes, use your ears, use your powers of broad observation to make sure that I'm doing well, because I may not be able to tell you. And you also may check in if I have someone with me, you can check in with them as well. Is this typical? Is this how this person acts if they're feeling okay, or are they anxious? You want to make sure that you do your full communication toolkit to make sure that they're doing all right. And a small reward is always helpful. People love the vaccine stickers. So if you have stickers, great. Or if you have a high five, or maybe you do a fist bump, that's always a good thing to let people know that they're doing well. So you all have an AFN toolkit, and it has a lot of tools in it. You have a whiteboard, you may have an iPad, a talker, A sensory timer, a sensory box rather, has all of the different fidgets. You also may have a timer that tells you how much time you have left. Most of us have cell phones. You can also set your cell phone on a timer so that you'll be able to know the 15 minutes. And then we've mentioned a lot about using smaller private spaces. It may be your environment doesn't have a separate private space, but you also may be able to position your body or position yourself or position some of the equipment that you have to enclose the space to make it a little less open to whatever everything else that's going on. And again, in all of this, even if you're doing vaccine after vaccine after vaccine, remember that you are providing individualized care to the person who's receiving the vaccine in your care. So that's what your we have a few photos here of what happens in your AFN toolkit, and there should be an AFN toolkit at each of your vaccination locations. We'd like to thank you. Dr. Ross would like to thank you. Jane Tobias, Dr. Tobias would like to thank you, and I would like to thank you from the Center for Autism and Neurodiversity here at Jefferson Health.